Hey everyone, it's Joe Weber. We're going to do coffee talk again. I have a guest, my lovely wife. This is Lynn Weber.
Hello.
Lynn and I have been married, oh wow,
20 years.
Yeah, about to be 21. Yeah,
Mhm.
99, yeah, 20. I always remember that, so of course I'm going to forget on video. But we're going to talk to Lynn, learn more about her. Lynn is a nurse, not practicing right now, but she was. And so, you want to learn more about my lovely wife? Here we go. Tell us about yourself, Lynn. Where are you from?
I'm from Monroe, Georgia, small town near Athens, and I am the oldest of 2 kids. I have a younger brother, Jason, and
Hey, Jason.
anyway, Monroe's a small town, and grew up there and loved it. Was a cheerleader and very involved in school. Loved Anchor Club and any club that they had. I practically joined it. My mom threatened me if I joined another thing, she was going to get me. So,
Mama, you better be watching this right now.
Smile.
How many clubs are you in?
I don't know, Co-Ed Y, Smile, Anchor. Gosh, I can't remember everything. But anyway, high school was lots of fun, and then ended up finishing school and went to college and didn't really know what I wanted to do. Went to Gainesville College and worked. And then once I started working at the medical center, I realized that nursing was probably going to be the thing for me. I really thought that would be the route I needed to take. So
What'd you do at the medical center?
I worked on the medical oncology floor, 5
Oh, wow.
East.
Okay.
So I did that and just finished up school and got in nursing school and got serious about, once I knew
Yeah.
what I wanted to do, I was like, okay, I got to, really push through and get all the classes that I need so I can get into the nursing program, and went to Brunel for nursing school for 2 years and got my 4-year degree for that. And at the end of nursing school, you have to do what is called your leadership practicum. And so you go to a place and work. And I ended up going to Children's Healthcare. At the time, it was Scottish Rite.
Okay.
And I worked in the ICU there.
Mm.
And I loved it. I never thought I would do pediatrics because the floor that I worked on was adults. And I loved it. And I thought, well, that's what I'm going to do. I'm going to work with older people. And once I went to Children's, I knew that was definitely, I was not going to work with older people. I loved the kids, and it was very overwhelming because it was an ICU and there were a lot of machines and things like that. But I felt drawn to those kids. And so once I finished the leadership practicum, I got, finished with school. You kind of have to start applying and things like that and looking at where you want to work, but obviously you have to pass boards first.
Okay.
So waited to take boards, and anyway, passed that and begged Children's to hire me. And at the time, when I was graduating, there was not a nursing shortage.
Oh,
So
okay.
they weren't just dying to have all us, 54 students that graduated. There weren't just all these jobs for us. So anyway, I was very thankful that I did get a job, and I worked night shift. And
Was that hard?
that was an adjustment for sure, but it was a great learning experience because it was a slower pace. You could look up the meds and you could really concentrate on your care. And normally I had 2 patients in the ICU. Obviously there's a lot of things to take care of, and so 2 patients is about all you need. But I would do, look up my meds and get organized and learn about my patients and be able to just learn, because nursing school is only the tip of the iceberg of what you need to know to survive. You have to really continue to study and to learn, because you're very green when you graduate and
I bet so.
clueless. So
They put you with somebody with more experience?
Well, you start out with a preceptor for 12 weeks in the ICU. So that was really beneficial. And so did the preceptorship with her for 12 weeks, but I
Mhm.
also went to classes and stuff and learned different things as far as how they calculated meds, because it's very different in pediatrics. You don't
Yeah.
look at pounds, you calculate with using kilograms. So
Oh,
you
okay.
have to convert everything, and obviously, if you think about it, you're giving a lot smaller amount
True.
to these children, and so it's very critical that you are careful and calculate properly. So my calculator was definitely my friend for
Mhm.
sure. But anyway, so
And that's back when you actually had a calculator, it wasn't on your phone, right?
yes,
Yeah.
absolutely had a calculator.
Thing.
Yes, and thankfully had a great pharmacist and a pharmacy right attached to the ICU, so we could call on them and clarify things. And in nursing there were meds that were hanging and different things that even before you hung it for your patient, you had to check it with another nurse and do all these checks and balances to make sure that you were being the safest.
Yeah.
So,
Give the right med to the right patient.
yes, the 5 rights,
Mhm.
very important to know. So, yes, but anyway, so did that and loved it. Got off night shift, thankfully, right around the time we got married,
That's right.
and
Woo!
that was great.
Yay!
So I felt like a human again because it was hard. You felt sluggish a lot working night shift, trying
Yeah.
to turn yourself back around. So it was good getting on day shift and feeling more like a normal person on a normal schedule, even though your schedule's not as normal as most people because you're working a 12-hour shift.
That's right.
And so I would end up, I'd leave home at 5:30 in the morning and get to work, and then get home by say 8:30 at night. So it made for a long day, but awesome place, awesome job.
Yeah.
Don't
do a good
regret
job.
it. Yeah. So very excited about that experience, and I met wonderful people, patients, families, and obviously my nurse buddies. Never forget them, and
True.
lots of fun, lots of good stories and relationships, and lots of crazy stuff that stand out in my mind as far as just the experience of ICU. And there's good and bad, and unfortunately you can't save every one of them, and
True.
their diagnosis isn't always one that is good, and so that's hard. That was not an easy part, to wrap a person in a body bag or put a toe tag on them and
Oh yeah, especially that young.
take clippings of hair and put it in a box for families. But there was a lot of gratifying experiences to remember too. And so yeah, that's a little tidbit about my nursing experience in ICU. And
I remember we used to get them. They had a helicopter bring them in. A lot of times you go get them, right? So that probably pretty exciting.
yeah, it was exciting. That was fun. I mean, you hate to sound like it's fun, but it is fun. I mean, there was different. They called it a hot unload. That was when the helicopter did not stop its propellers, and you had to go and you were gowned up, masked up, and you would go out there with a stretcher, and they would pull this little one out of the helicopter on a board, and you would put them on your stretcher, and away you would go, and then get back downstairs and start working with them. And then a regular cold unload would be, obviously the helicopter had time to stop the propeller, and you would go and recover the child and go back. And another thing, the unit that I worked in, we would have to respond to codes on the floor.
Oh, okay.
So the charge nurse at the time would take the crash cart, take it down, and start working with the patient. And so that was really, that's exciting and also scary.
Yeah.
But that was another responsibility that we had. And then also helping out with starting IVs on the floor. Some of the nurses would call on us if they had kind of exhausted all their resources there. They would call us, and we would go and help them to start an IV on their patient and get that going. But the ICU is an intense place with life-saving meds that are hanging
Mhm.
and you have someone's life in your hands, and that's something that you don't take lightly
Mhm.
at all. And realizing that any adjustment you make on a machine is so crucial because it can be life or death.
Oh,
And
really?
so it's important to realize, and obviously be aware of what you're doing and alert, and just being able to think about that patient and put them, as your first priority. And you're also their advocate. You are reaching out to the doctors regarding their care. And if there's something going on that, is not working or seems to be going, south, then you reach out, to the doctor. But you have a lot of autonomy in the unit to make decisions and to, give care. And that was, a great part of that job.
Yeah.
And just the different experiences that came with that, but also stepping away from that after not working there anymore, realizing that I not only needed a break from driving to Atlanta in the traffic, but I needed an emotional break from that intensity, because I think over time it can get to you.
I can see that.
And so I realized, yes, I needed to take that break.
Mm-hmm.
And just kind of regroup and figure out something else that was a little less stressful. So I guess working for you was that. So
Not stressful.
No. So anyway,
Mm-hmm.
I was able to, obviously come into the office and work with you once I stepped away from the working in the ICU. And then
We spoiled her.
well, it's definitely nice to have the flexibility, and then knowing that, you're not going to kill anybody in the dental chair by talking to them.
That would be a bad day. Yeah.
Yeah.
We dropped dead in the chair. It's going to be a bad day for us.
Right. So, anyway, a lot more low key, and, but it's still dealing with someone's health is so important, and, talking with them about aspects of their health. So that was neat to do, but not to have that life in my hands, so to speak. But, and then, of course, comes along baby number 3.
Mm-hmm. Yeah.
And then,
We'll get into that another year or another day, another night, probably.
yeah.
Yeah.
Anyway,
Yeah.
So yeah, little tidbit about.
Didn't you also work in the PICU?
No, that is PICU. Yeah.
Okay.
Yeah.
Oh, okay, so explain that. PICU.
Yeah, PICU is Pediatric Intensive Care Unit. So PICU for short, just to shorten it a little bit. But anyway, so basically, it's a kids ICU, and we took care of kids that were a day old to 21 years old. And so that gives you a big idea of kind of the different stages of life. So, which is cool. I mean, you had a lot of different things that we dealt with, whether it was someone that was a teenager struggling with issues and attempting suicide, and getting to talk through with them, just about life stuff.
Mm-hmm.
And then
so you would sit and talk with them at some point.
Yeah, we talk with them, and we would, as you're giving them their care, and putting charcoal down an NG tube to help absorb the meds they've taken.
Okay.
You're able to talk with them and just see if they'll open up, because you are an unbiased opinion, so to speak. And
True. I guess some did.
Sometimes they're willing to kind of just put some things out there, but also just the little ones. Sometimes we would have the NICU overflow, so those are the tiny little preemies.
Mm-hmm.
And sometimes we would get those little ones in there, and they were just trying to gain enough weight to basically get home. And so we would have them, which was probably
Okay. What do they have to weigh?
They really just needed to get to a sustainable weight, but also most of the time they would have to make it to their due date, so to speak. So
Gotcha.
if they were born 6 weeks earlier than their due date, they pretty much stayed in there roughly 6 weeks, unless they just grew and excelled by leaps and bounds then pretty much they were going to spend that much time
Hmm.
in there. But some would surprise us for sure. But we had near drownings, we had ATV accidents, jet ski accidents, just a little bit of everything. Car wrecks. Gosh, I'm trying to think of all the things we saw. Many things. I mean, surgery kids that need a fusion. They have spinal issues or
okay, put them there.
Scoliosis, kyphosis, things that,
So they'd make their way to the ICU.
Oh yeah, it's very painful. They have to be log rolled and yeah. When you're getting a fusion like that, you definitely want to have some good pain meds.
And they can do that at the ICU.
Yes, that's one thing. A lot of the surgery kids will end up coming to us because their surgical procedures cause a lot of pain. Therefore, in order to medicate them well enough, they need to be monitored closer.
And explain that, because when we first met, you would literally sometimes sit the entire shift at the patient's bedside.
Yes.
I mean, never leave them, because you had to stay on that. You had to be right there just in case anything changed.
I mean, literally the way the unit was set up at the time, literally you had a curtain that was pulled and you had 4 isolation rooms that had glass, doors and walls, but the rest were curtains, literally. So you could pull back your curtain and you could look down and see, 8 to 10 patients in beds.
Okay.
So it was great because then obviously we could help keep an eye on each other's patients, and therefore, if an alarm's going off, we can look up and see, oh, it's bed number 7 or whatever. But anyway, so I would have 2 patients and I would sit there and, be charting on one, and I could look right there and there's my other patient. So, some patients you had to do vital signs on every hour. So if you're doing vital signs, you're checking their fluids, you may be starting a new IV on them or changing out fluids. If things are not working for them, the doctor may have ordered something different, or you may be hanging drips. If their blood pressure is crashing, you may be putting them on dopamine or epinephrine and starting those medications so that they can, stay alive. So literally, there's times it's touch and go. I mean, I had a patient before that there were 3 of us taking care of her at the same time. I mean, one was just steady hanging blood products, and the other was, whether changing a dressing or, doing vital signs. I mean, just that sick. And, kids come in with E. coli and end up in kidney failure and then have to be put on dialysis. And, there's just a list. It goes on that the things that, can put you in an ICU. We would have HEMOT kids, the cancer patients that were actually not doing well, whether their counts were really low and they needed a lot of blood products, or just running fever and just, going into septic shock. And then, that would win them a bed space in our unit, unfortunately. But it was crazy. I loved having those patients. I don't know what it was about them. And it's interesting with our story that, here I was in nursing school on a medical oncology floor with adults.
True, yeah.
And then ended up working in an ICU with pediatric patients. And then we end up, after having our 3rd child, end up with anally being diagnosed with a brain tumor. So it's kind of crazy how God works all that out. But
true.
I'm thankful that, He led us down the road that He did, and I was able to understand. And and it's weird. I never thought I would do pediatrics, and that was what I loved. So
kind of the challenge of it too. It sounds like.
Oh yeah. I mean, it's amazing to see a life before you, change and thrive when you thought, the day before they were teetering, on death. So yeah, it's very gratifying. Yeah, very much so.
Wow.
How'd y'all meet?
Where'd
Where'd I come from?
you come from?
There's that voice again.
I know. Well, it's funny because I had worked a 12-hour shift and came to a friend's house for a Super Bowl party in my Snoopy scrubs. Came to get food and got a husband. So,
Same night. It's good.
not.
That's a great investment.
So that night was meeting you and
Mm-hmm.
lots of fun, just having a great conversation. And then you pump my gas and
In her car.
then that next week we ended up going on a date and we're together ever since.
Yeah, I guess the rest is history, right?
Yep.
You only tried to dump me one time, so that's it. So that's good.
Are you serious?
You can cut that out. But.
Wait, are you serious?
I'm like, are you seriously gonna say that?
Wait, is it
It's kinda
true?
funny. Huh?
Is it true?
Well, for like a day.
What?
Ding dong.
Wait, this is when y'all were dating?
Damn, Lynn.
Yes.
Yeah.
I
Mm-hmm.
might leave it in. That's a good clip.
That's good.
It's fun. If you want to know
Breaking
more,
news.
send a message. We'll let you know. We'll do another video on that. We're not going to tell say anything else about that.
You heard it here first, ladies. Give them one more chance.
It's true. And have a 2-year rule. So,
Yep.
yeah, so we met at a Super Bowl party, actually. And
Yep.
New England was playing Green Bay.
Of
I
course.
remember that because I could care less who won, and I think I ended up having to pull for Green Bay in some bet I was in. So, and be careful what you ask for, because 30 minutes prior I was eating a brats, drinking a beer, and realized that I would be single the rest of my life, and was okay with it.
And then I walked in
Yeah,
with Snoopy
And
scrubs.
she walked in, so kind of changed everything after that. Thank God. So, all for good.
Definitely.
So, yeah, we'll cover our life later. I don't know if that's an involved thing.
That's a long work.
That's a long work podcast, yeah.
So,
But we got
after
3
wrapping
kids.
it up,
Yeah.
Mm-hmm.
This is the oldest that's doing all the conversation here, by the way.
they've seen me. I've been on the first 2
True.
episodes.
I want to do this in front of the camera.
Not there yet. Almost. There you go. Okay, so as we're wrapping it, just give some advice to anybody that's looking at going into nursing or, wants to be a nurse. Just give some advice for anyone that's interested or going through the nursing process right now, or
Yes.
even is a nurse right
Well,
now.
actually, like right now, though, you said the opportunities are a lot more open. It seems like they're really
Yeah,
asking. So that's a good
Yeah,
profession to be going into.
absolutely. I feel like there's a lot of flexibility with nursing. If you don't want to do patient care, you can do case manager or you can work as a school nurse. There's just a lot of options in nursing. You can work at doctor's offices. You can work in the surgery, go to surgery and work. But, there's obviously hospital nursing and it's a great profession. It's job security for sure.
Mm-hmm.
I mean, healthcare is huge. And
Only getting larger.
flexibility. I think it's great for having a family and having options of shifts to work,
True.
things like that. So,
And, what I heard was don't be set on one thing because you'll never know what might get you that you really want to get into.
absolutely, yes. I never expected what I went through. And, there's great schools around. And if you can go and get your 4-year degree or you can go and get your associate's degree and get out there and work and then go back later and get your bachelor's.
Yeah, because that helps you go on further into other stuff, nurse practitioner and things like that, right?
Absolutely. Yeah, you can go nurse practitioner, nurse anesthetist, lots of different options. And as a nurse practitioner, you can be a family nurse practitioner or pediatric. And but I say it's great. I don't regret it at all. I loved working and I feel like God's calling me to do something. I don't know what yet, but I feel like I'm kind of itching to get back into nursing some way, somehow. So we'll see.
You'll do great at it.
Thanks.
Mhm.
All right.
Have anything else you'd like to add to all this?
No, I've enjoyed it. Thanks for letting me come on for the coffee talk.
Coffee talk. Yes, it's been great. So this is Joe Weber. Thanks for watching. If you made it this far, we appreciate it. We'll come back later, my lovely wife and I, and kind of go through some family stuff, which ought to be beneficial, hopefully, for some folks, and you learn more. So thanks for watching. Take care.